Hi Ashley, I'm here at beautiful Washington Park. I appreciate the opportunity to be talking with you. I've been talking about ways that we could get and stay healthy during this pandemic, such as getting proper sleep, staying properly hydrated, drinking enough water during the day, eating a healthy diet, managing stress, and of course exercise. And the last time we talked, I talked about the importance of getting our vitamin D levels up, especially for our immune system. Today I want to talk about exercise. Unfortunately, only 1 in 2 Americans are getting enough activity during the day. And from age 30 to 80, we have a gradual decline in our muscle mass. And in fact, from 50 to 82, we lose about half of our muscle mass. And that contributes to disability and health, and even contributes to our own mortality. So what can we do? I suggest that we need to get what the guidelines recommend is a minimum of 150 minutes of moderate physical activity per week. And really, if you break that down, it'd be like taking a 15 to 20 minute walk twice a day. And also we need to really think about doing a combo of strength and aerobic conditioning. But I'm going to talk about more just what can we do to get out and move. The parks in our neighborhood. I know during this quarantine, people are working from home. We're quarantined to mainly staying at home other than going to the grocery store. So we want to keep good social distancing, but we want to get out and we want to move. And if you are sitting at your desk or you are working from home, we need to make sure we take breaks, and anywhere from 30 minutes to 45 minutes, we're getting up and moving in some capacity. For my back patients, I typically recommend that they are not sedentary. And yes, if they are acute severe pain, they may have to be down and out for 1, 2, or 3 days. But in fact, bed rest and being sedentary is contraindicated for back pain. It delays recovery, we get weaker, we get stiffer. So I typically recommend that they do some form of mobility, some activity, and typically walking is something that they can handle. Sitting prolonged, standing prolonged usually aggravates. The other thing I recommend is that they do not, and all of us, we shouldn't just jump right out of bed into our routine or exercise routine, because we are about 20% more susceptible to injuries in the morning. This, according to Dr. Stuart McGill, is a PhD in spine biomechanics. So our discs take on more fluid, we're a little more hydrated, we're stiffer, so we're actually more susceptible to injuries when we're doing more bending and lifting. So we want to get out, do our normal routine, get warmed up, and then we could get on the floor, do some gentle mobility. I like the cat camel. That's low loads on the back. That warms us up. Doing some stretching of our hips, maybe some calf stretching, and then getting out and going for that walk. And you could do it longer, but minimum would be 15, 20 minutes. And again, if we do it twice a day, that would be great. The next thing we want to do is we want to make sure we're doing something for strength. I know Dr. Curtis had talked about that in the past, but simple walking in the neighborhood in a nice park like this does both our mind and body good. Americans are already stressed, and during this pandemic we're even more stressed. We're sedentary and we overeat processed food, refined sugar, fast food. And so exercise, studies have been shown that exercise can actually have a reduction in depression. It makes us feel better mentally and physically. So Ashley, thanks for having me. Let's get outside and exercise. Let's keep our social distancing, but let's move and let's try to stay healthy during this pandemic. Ivy, come here, buddy. There you go. Come on, let's go.